Welcome to Newstalk. Joining us this morning, Eric Litwiller with the Mental Health America of South Central Kansas. We're here to talk about the potential impact proposed Medicaid cuts could have on mental health care across the state. Good morning.
Good morning.
Okay, so let's talk about the big picture here. What are the proposed cuts to Medicaid?
So the last I knew, and it seems like the number continues to grow sadly, but it's several hundred billion dollars, of Medicaid cuts nationwide. The thinking being that this could save taxpayers all this money if we were not funding Medicaid. And I understand that. My concern becomes, though, it's easy to float to a taxpayer, hey, you can save $10 by us cutting this program. What the elected officials, though, were not telling those taxpayers is, yeah, we'll save you $10 today, but tomorrow it's going to cost you $100.
Yeah.
They're not carrying forward what the true impact of these cuts would be.
Yeah, absolutely. So let's talk about those potential impacts across health care. What could those be?
Well, they're massive. I mean, if you think about what Medicaid does on a national level, about 20%, 1 out of every 5 Americans relies on Medicaid for just basic day-to-day medical care. About 40% of children nationally rely on Medicaid for day-to-day national medical care. In Kansas, roughly 400,000 people in Kansas rely on Medicaid, which is essentially, obviously, the entire population of Wichita, if you think about it. 56% of those people are children. So the impacts are substantial. And when you're talking about cutting that, now you have to think about, again, carrying it forward, what happens if that health care is not available? And the concern becomes, most people would do probably what a lot of us do, sadly, which is, I know something's a little wrong today, it's not a big deal, I'm going to keep going. And then every day it gets a little worse and a little worse and a little worse, and pretty soon now you're operating in crisis mode because you chose not to go to your doctor today. In a week or in a month, it's so bad you need crisis intervention. Without day-to-day medical care, you have no choice but to not get those things looked at until they're so bad now you can't operate. And when that happens, you're going to the social safety net, you're going to hospital emergency rooms, and now you saved $1 by not going to your general practitioner today, but you're paying $10 or $100 because now you're seeking crisis intervention care, you're seeking emergency care, which is funded by all of us.
Yeah. Now, we've sat here multiple times and we've talked about how catching stuff early is the key.
Absolutely.
And like you mentioned, it can have long-term effects.
Yeah, it has very long-term effects, especially when you think about the fact that most people on Medicaid are low-income individuals. But they're able to go to work every single day and man the front desk or serve you at your table at a restaurant because they know that they have that social safety net for themselves, for their children. When that's taken away, these individuals now don't have that safety net, and so all the low-income individuals who are working in our businesses and working in our companies that we see every day cannot maintain that stable, gainful employment. We're already operating in a place where it's hard to find employees, and when you take away that large segment of low-income individuals who are working for us every day, they can't anymore because their kid got sick and they don't have insurance to take care of it, so they have to stay home. That has massive implications for the very long term, and it's a very scary prospect. So what we're asking for is people to reach out to their senators, reach out to their congressmen, and try to get them to recognize the long-term implications of what these cuts would mean for our state.
Well, Eric, thanks so much for coming on this morning. We appreciate it.
My pleasure.
All right, everyone, stick around. We'll have a final look at your forecast with Halen.